We are recording this webinar. Okay, so just to begin, I want to introduce myself and the members of the team that are here with us. I'm Samantha Breslin. I'm the project coordinator for the dashboard, and I'll be joined by Shoshana Levine, who is our program director. But there are a couple other dashboard colleagues on the call, so if you have any other questions that either of us can't answer, they'll be able to hop right in. And just as a brief run of show, we'll do a quick introduction of the dashboard. Then Shoshana will do a demo of the website and its features, and then we'll dive into our topic of focus today, which is exploring how you can use the dashboard in your classroom, either in person or virtually, as is becoming more and more common this year. And then, as I said, we'll leave most of the time at the end for questions. So Shoshana, if you can just share your screen with the slides, that would be great. Awesome. Thank you so much. And you could just go to that next slide. So at the dashboard, our goal is to help cities across the US leverage the power of data to improve the health and the well-being of everyone in their community. Slide. And we do that, by providing over 35 measures of health, the factors that shape health, and the drivers of health equity for over 750 cities across the US. And when we started just over 2 years ago, most data on health and its drivers were not organized at the city or the neighborhood level, but rather the county or the state or national level. And we changed that 2 years ago when we launched for the 500 largest cities in the US. And this spring, we actually expanded the reach of our tool to any city, any US city with a population of over 50,000, so 50,000 or above, bringing our total to 766 cities across the US. So it's a very exciting time for us. We're evolving and we're changing. And I imagine these next few years will continue to be exciting and will continue to evolve. Next slide. The dashboard, as I said, we launched 2 years ago in May 2018, and it was developed by our team here at NYU School of Medicine, Department of Population Health, but it was also in close collaboration with the National Resource Network, the National League of Cities, and ICMA. And in developing this dashboard, we worked really closely with our city partners on the ground, both in terms of getting their input and feedback on measure selection, website design, user testing, in order to create the easy to use one-stop resource that you see on the website today, which is with the ultimate goal of really creating healthier, more equitable communities. And we're an academic institution, obviously, so it was really important for us to get those real world city perspectives when designing the tool. Next slide. And we designed the tool, the dashboard, to be really flexible. And it can be used in any number of ways, but I have 3 listed here, which are, I think, the most salient ones. So a user, you can come to the website and you can compare health gaps across neighborhoods and really dig into what could be causing those differences. I have here a map of Columbus, Ohio, looking at life expectancy, and we've pulled out 3 neighborhoods that have very different life expectancy. So these neighborhoods are actually less than a mile away, yet someone living in that neighborhood at the very left can expect to live 20 years less than someone living in a neighborhood right next to him. And so someone who can come onto the dashboard and really investigate why that's occurring. Users can compare their city to cities in other regions or cities with similar population sizes or demographics, and dig into, and figure out, what can I learn from that city? Where are there peers that I can maybe reach out to and help them set goals? And users can also use the dashboard to set priorities and better target their resources towards neighborhoods or populations that need them most and really maximize that impact. Next slide. And when we applied a really rigorous criteria in selecting the measures for the dashboard, I've listed them all here, but I'm only going to dig into a couple of them. But all of the metrics that we have, all 30 over 35 of them, come from national data sets. And that's one of the biggest strengths of our site, is that if you're looking at excessive housing costs, that the way housing costs is measured here in New York City, where I am, is the same as it's measured in Detroit, Michigan. So you're really comparing apples to apples. We also wanted our data and our metrics to reflect public health priorities and really resonate with local communities on the ground. And then finally, all of our measures, they're all measured, or they all exist over 5 overarching domains. Next slide. And the 5 domains are health outcomes, clinical care, physical environment, health behaviors, and social and economic factors. And you can see all of our measures listed here. There's a lot of them, I know, but they're really spread evenly across these five areas to give the user, that 360-degree, really comprehensive view of community health. And so the measures on this slide listed in navy are available at the city level only, and the measures listed in yellow are available at both the city and the neighborhood level at this time. And with that, I will pass the baton over to Shoshana, who will take us through the demo of the website and really show you the dashboard in action.
Great, thank you so much, Sammy. I am gonna close that out for a sec, and I'm going to take you to the City Health dashboard. So this is the landing page. If you just go to cityhealthdashboard.com, it's a free site. All you need to do to access all of the data we have here is have an internet connection. And that, again, was also really important to us, making sure that this data was accessible to the communities that it represents as well. So we get to the site and we're interested in exploring health in our city. So today we're going to be from Wilmington, Delaware, and we start typing that in. We get Wilmington and click there, and it opens up our Metric Explorer. And you'll recognize this or this list of measures from the screen that Sammy just showed. But we have our health outcomes, our social and economic factors, health behaviors, physical environment, and clinical care. And just to take you through the site today, I'll choose children in poverty. And I'm going to go through a lot of things. I'm going to go fairly quickly. Feel free to jump in and stop me. Either raise your hand or just take yourself off of mute. We want this to be formal, so feel free to ask questions as they come up. But I'm also happy to answer any questions you have at the end. And there's a lot that I'm not going to show you today, just because we don't have time to get into all the great things that we can do here. So if there's anything you think I'm leaving out, I'm more than happy to go into more detail for something that's interesting to you. So we have here some more information about the city, and then our navigation bar that goes across the screen here, and then the information about the measure. And if we open this up, we'll get some more information about the data source, the years that it's from, some tips and cautions, and more about the metric, how we calculated it, why we think children in poverty is important, things like that. And next, we get to the most interesting part of the site is the data, what we're all here for. So we can see that in Wilmington, Delaware, 37.9% of children live in poverty, compared to an average across the dashboard cities of 20.4%. And this gold bar is that city or census tract value. The blue triangle is our dashboard city average. This blue checkmark in the circle indicates kind of the direction you're trying to move in. So for children in poverty, a lower number is better. For something like a high school graduation rate, a higher number would be better. And so it's just kind of a visual signpost to help you see that at a glance. And then if Wilmington was doing better than the national average or the dashboard city average, we would see this green check mark right here above that value. Because children in poverty is one of our measures that's available at the census tract level, we can also scroll down here and see how that measure plays out across the city. So as we saw above, the value for the city as a whole was well above the dashboard city average, but we can see, and if we click on some of these census tracts, we can line them up on the side of the page, that there's several tracts that are well below that dashboard city average, several that are well above it, and a lot of these census tracts, these neighborhoods are actually right next to each other there. And so you can line them up, you can dig into them in more detail, and you can find the areas that are most interesting to you. We also have the data available for this measure by demographic breakdown. And we provide this data for these demographic breakdowns for about a third of our measures. And we're kind of limited by the data source and how it's collected, but we try and find data sources that we can prevent demographic data as much as we can. So you can see here the demographic breakdown for this measure, and I'm sure it would be surprising to no one that it is not that poverty is not spread among children from different racial ethnic groups within the city. Next, we have this ability to compare cities that Sammy was talking about. And this is something that we heard from cities when we were developing this site. I'm always compared to this city in my state because it's easy, because we just get our data from the state. And it's not a great comparison because they're bigger, they're smaller, their population is really different for some reason. And so we give cities the ability to make these comparisons in two ways. So if Wilmington, Delaware maybe wants to compare themselves to Scranton, Pennsylvania, they can start typing that in there, and we can click and we can put those cities down here next to each other, and we can make the comparison that way. But perhaps Wilmington isn't sure, or you're from Wilmington, you're not sure who a good comparison city would be. We have a couple of different ways to figure out what that comparator should be. There's different general characteristics about the city. You can compare by dashboard measures, and these are different filters. And as you put them on, you'll get more or less cities come up. So this population, there's 92 cities in the same population band. And when you look at the federal poverty level, that goes down to 2. But interestingly enough, and I can show you quickly what those cities are, but interestingly enough, the dashboard conducted a project that just came out last month where we divided the cities on our dashboard up into these city types. And this was based on an analysis that looked at things like population size, like demographic characteristics, socioeconomic characteristics, and other things like that. And you see that Wilmington, Delaware is a small industrial legacy city. There are 13 other cities within the dashboard that are also that type of city. And if you're interested in learning more, you click that question mark there. Here's a quick summary, but there's also a link out that I'm not going to click on right now to our city types page that goes into detail about all the different city types. You can download the report there, and you can look at the data behind what we're talking about here and make some comparisons within and across city types. So perhaps now we're interested in looking at Trenton, New Jersey, and maybe Stonecrest, Georgia as comparisons because they're within our same city type. And you can see that even within this type, the range of child poverty goes from 37.9 in Wilmington, Delaware, 39.2 in Trenton, and 29.2 in Stonecrest, Georgia. We also have the ability to compare measures. So we have children in poverty here. And if we're maybe interested in access to healthy foods, there's a few ways that we allow you to make a comparison on the site. The first way is this metric comparison map. And so you can see we have our 2 measures here, children in poverty in blue, and limited access to healthy foods in this reddish pink color. And for both measures, the lighter color or the lighter tone indicates a better outcome. So you can see when we overlay these 2 measures that in a lot of cases, you have the matchup of the lighter tone, the lighter blue color with lower children in poverty, the lighter pink color with lower rates of lower rates of not having healthy food access. But it's not always the case. So here are the tracts that we looked up earlier, and you can see that some of these census tracts with really high poverty actually have really low rates of not having access to healthy foods. So this is maybe a way that you can look at what might be going well in certain neighborhoods and how you can learn from areas where even though certain things or you have high poverty rates, it doesn't mean that that you also have high rates of unhealthy food access. So we also finally have this take action site. So we heard from a lot of cities when we were developing the site, great, you told me that I'm not doing very well in this area. What am I supposed to do about it? So we have a couple of different ways for you to think about taking action. First, finding programs and policies. You can look for specific programs and policies that are evidence-backed or promising and explore them for whatever measure you're interested in to think about taking action. We also have some really practical tools that are maybe less focused on a particular measure or a particular outcome, but really more aimed at kind of how you do this type of work. So looking at finding partners, exploring strategies, so things about communication, how to actually be an advocate, different advocacy resources and things like that, policy change. We have different funding finders. And finally, we have different tools here for measuring impact, so thinking about evaluation and looking at just the impact of what you're doing in your community. And one last thing I wanted to show you, we make all of our data available on this data access page for anyone to access and download. So you can get it in two ways, through a downloadable file, or if you're an API user, you can connect through an API. And here, I'll just show you quickly this page. We have all of our data accessible to anyone who wants to get to it. So now I'll pass it back to Sammy, and I'm again more than happy to answer any questions you might have.
Thank you, Shoshana. That was great. And then just great. So for why we're all here, how can we use the dashboard in the classroom? And when we built the tool, we kind of thought that practitioners, officials in health departments, or city government employees would be our main target audience. And of course, they are one of our main stakeholders. But soon after launching, we noticed that more and more researchers and professors at academic institutions and universities, students and educators, really at all levels, were engaging with us and our data in a lot of different, really cool and really interesting ways. And we track, our website analytics. Like we're seeing every month, we see, who's coming to our website, where are they accessing it from, who's downloading our data. And, consistently month over month, we're seeing more and more people from the academic community, logging on, downloading our data, accessing our data for, a wide variety of things like presentations, projects, posters, lesson plans. It's been really exciting to see this, this community come out of the dashboard and get really engaged with us. So, next slide. How can the dashboard help you? How can you use it in your classroom or in your work? I have a couple listed here that I think, again, are the most relevant. But as I said before, we're really flexible, and the dashboard can be used in many number of ways. But a lot of the themes that we cover on the dashboard, racial disparities, poverty, income inequality, diversity, life expectancy, they're pretty complex, even for the most advanced person, including myself. And I look at this website, 100 times a day. And these concepts are all, very connected, very interrelated. They're not siloed. So yes, excessive housing costs is a housing issue, but it's also an economic issue, a health issue, and a racial issue. And it's often hard to grasp these challenges by reading a textbook alone, especially now as more and more schools have gone virtual. It can be really tough to stay engaged and stay focused. And the dashboard provides this easy to use, at a glance, hands-on, interactive way for students to see how health outcomes may relate to social and economic factors or the built environment in their city and in their neighborhood. And the maps and the features that Shoshana showed you allow students to really investigate and dig into any neighborhood or racial disparities and use their critical thinking to figure out what could be driving those differences. It's a great complement to a lesson plan focused on a wide variety of topics. And, I'm just thinking, obviously, housing costs has come to mind for me today. But, if you're a teacher who is studying with your students redlining in 1930s, that might seem very far away, very distant from, your students' lived experiences. But obviously, we know that the impacts and the consequences of redlining are still being felt today. And the dashboard and the data on it can really help make those connections and bring, the topic off the page and really have more of an impact with your students today and show them, make those connections to them. And it can stimulate important conversations. There's a lot going on right now, from the acute needs of the pandemic to the economic hardship that families are facing and will continue to face as the pandemic evolves, and to the continued violence against Black and Brown communities brought on by racism and a racially unjust system. And the dashboard provides an avenue for teachers and parents to start having honest conversations with their students about this stuff. The data provides a foundation and a backdrop to talk about these challenges. It may quantify or visualize an issue like smoking, for example, that students might already understand as a problem in their school or in their community. And the local level data can get students thinking, why does my census tract or neighborhood have a shorter life expectancy than the neighborhood right next to me? And how can I, as a student or as a community member, get involved to help change this? And so we've seen that simply by having the facts and being able to present them in meaningful and digestible ways can help empower students to get more engaged, be more involved in the classroom and in their community, share their voice and their experience, and really make a difference where they can. And finally, for many professional degrees, like an MPH, for example, some set of competencies, either quantitative or qualitative, might be required for graduation. And by making all of our data accessible, either through download or API, and just really the breadth of information that we have on this site, students are able to hone in on their analytical skills, learn more about data collection and how data can be used for more effective programs and policies, and how data can help this next generation become better, more effective public servants. So next slide. And as I said, and I continue to say, there really is an infinite amount of ways to use the dashboard, but I'm going to quickly share a few with you today. So last year, late in 2019, a middle school class came to visit our office back when we were still in offices, kids were still at school, and we were allowed to have field trips. But we prepared this dashboard introduction worksheet for them. And each student was a mayor of a city of their choice. And we asked them to explore their city and see what issues different neighborhoods were facing and how they compared to the rest of the city. And we then had students come up, brainstorm ideas and come up with programs to help move the needle on those specific issues. And some of them were funny ideas, classic sixth grade, but students really came up with salient, really thought-provoking programs to really address these challenges, which is really great to see. And next slide. And for at the undergraduate level, in a population health management course at Rider University, the professor had students draft these case studies where they were the CFO of a city hospital. And students had to use the dashboard to identify the top health concerns of the city and what were the biggest drain on hospital resources, and then use that data to help develop hospital strategies to not only address those health challenges, but also improve the financial bottom line for the hospital. Next slide. And finally, at the graduate level, in a Foundations of Public Health course at the University of Memphis School of Public Health, students were asked to assess population health needs using the dashboard and draft policy briefs, making the case for the social determinants of health to policymakers and identify the city's top priorities, which was really cool to see. And all of these examples that I have got into or that are listed on these slides can be found on our education page on the website, which is linked at the bottom of the slides, which I will also, we will share those on our website, but you can also find them by going to cityhealthdashboard.com/education. Next slide. And then just finally, we have developed this Data Explorer worksheet, which again can be found on our education page. And this is a really helpful tool both for new users and advanced users alike, because it walks through the dashboard and all of its features and asks people to identify what they're seeing. You know, what are the city's strengths and challenges? What, if any, racial ethnic disparities exist? And ask users to brainstorm what policies and programs can be used to address those challenges. And it also, one of my favorite parts of this worksheet is that it asks users to think of other data sets that can be used in conjunction with dashboard data to help get that more complete picture of health, because we're not the only one in this game. There's a lot of other data sets and tools that provide really, really, really important information as well. And I just want to also reiterate that, there are a lot of different ways to engage with the dashboard. Of course, we have this worksheet to help you, but the examples that I shared earlier, besides the middle school example, those were professors who kind of found us on their own, and they developed those assignments. So if you need any help or have any questions or want to brainstorm, please don't hesitate to reach out to us, and we'll be more than happy to work with you or connect you with these professors who have used us. With that, I will open it up to the formal Q&A, but I have just some ways for everyone to stay in touch with us. We want you to stay connected to us. We have, you can find us on social media or email. And again, we are always here to, brainstorm, work with you, and help you to better leverage the dashboard in your work, both in and out of the classroom. So I will open it up for questions. That is the end of the formal presentation. So thank you all. I'll go to the chat. So if anyone has any questions, either, feel free to just unmute yourself, or if you're more comfortable, you can write them in the chat as well. Great question that came into the chat. Has the dashboard considered looking at LGBTQ as a demographic? I actually don't think I can answer that question on my own. I'm going to, Shoshana, do you have that? Or I can look to Taylor, who is on the call as well. I assume it's because of a lack of data availability, but I don't want to talk without having the full the full story there.
Yeah, if someone from the data team wants to jump in, that would be great.
Yeah, this is Taylor. Can you all hear me?
Yep.
Hi, everyone. I'm a data analyst on the project, and this is a great question and one that we've definitely been considering since the start of the dashboard. One of the main criteria, as Sammy mentioned, for inclusion of data on our site is that it's accessible across all of our cities, and that includes cities across the entire country, and that we can get it from a central data source. And so for this kind of data on LGBTQ individuals or relationships, the ACS is the only, as far as I know, and please correct me if I'm wrong, the only centralized data source of that kind of information. And the only, I've looked into this a lot, the only metric available is percent same-sex couples, and that isn't available for all of our cities or in a timely manner. But the 2020 census is having more comprehensive questions on relationship status. So there's a chance there might be something we could incorporate there. But at the time, we are limited by data accessibility.
Thank you, Taylor. And as Taylor mentioned, if anyone has any, we're always looking for, data sources and new metrics. So if you have any ideas or can point us to, a location where we can find new data, we're always all ears. And then we got a question from Denise. What is the source of your data? Do you collect data yourself, or do you use third-party sources such as health departments or health data? Another great question. We have a few different sources of data. Taylor mentioned one being ACS, which powers quite a few of our metrics. I think that's our biggest data source, but we also use the CDC's 500 Cities project. The USDA provides some of our data, and we also get data from proprietary sources. So, for example, our walkability measure is provided by a company called WalkScore. So it really kind of runs the gamut. We do not at this moment, and we also, of course, use the National Vital Statistics System from the CDC as well for all of our health outcomes data or metrics. We do not use individual health departments as a data source because we would have to go to either all of the 50 states or the different cities for the data to get the data, and it's just we're a small team of around 7, and it's just not feasible for us at this moment. So everything that we have is at the national level.
I'm just adding to that, Sammy. It's, we know it's a trade-off because we get our data from these centralized sources. It's standardized. It means that we're able to collect the data for all the cities on our dashboard, but it also means that there is some lag time between kind of the year of the data and when we're able to get it up on the site. And it means that kind of tying into the last question we just had, it can be challenging to find measures that we're interested in where data is available for all or at least a large majority of our cities.
If there are no other questions, I can definitely stay on the line for just a bit if anyone's shy. But if not, thank you so much for joining us for our office hours. Please, as I said, stay in touch. We'll have another office hours next month focused on data access and our API and downloading the data and how to use that downloadable data. So I hope everyone has a great week, and thanks so much again for joining us. Okay, thanks everyone. Have a great rest of your day, and we'll see you next month.